I'm former minister of Turkey. I involved in politics in 2002 and appointed as Minister of Health just after I involved in politics. And I oversaw a very great health transformation program for more than 10 years in Turkey. And I know that there is a remarkable differences between the context of Turkey and India. We have 78 million of population in Turkey, and we felt ourselves very big country in Middle East. But when you come to India, you feel that, you are in very huge country and a very different context and very different situation. So I'm not going to try to give you a blueprint about health financing. I know that different contexts needs different solutions. But I'm going to give you a brief journey from what we did in Turkey for within 10 years as health transformation program in Turkey. I should say that people dealing with public health have to focus on equity rather than equality. It is very important for the poor people. It is very important for the people most need. So, after 30 years of slow progress, we have been able to design and implement large-scale health system reforms to achieve universal health coverage that substantially reduced inequalities in health financing, health services access, and outcomes. And of course, we have to focus on access for all and affordable cost if we talk about universal health coverage. And we have to focus on final goals first. I visited many countries to give some consultancy to share my experiences, and I recognize that many countries focus on only health status, life expectancy at birth, maternal mortality ratio, infant mortality rate, but it is necessary to focus on some very important outcomes as well as focusing on health status. When you look at health spending and life expectancy at birth, some selected OECD countries, you see that almost all of the countries increased the life expectancy at birth. And when you look at this graph, Turkey increased life expectancy at birth from 72 to 77 within very short time, and with a limited increase of the budget, the expenditure of health. It means that it is very important to use money in an effective way to have efficiency gains. Another point we have to focus on is what is the satisfaction rate in public services. It is very important sign about your results, and satisfaction rate from health services in Turkey increased from almost 40% to 75% within 10 years. And compared to other public services, the increase was the highest. And relationship between patient satisfaction and health expenditures, Turkey shows a unique position compared to some other EU countries. Of course, we increased our expenditures for health services, but at the same time, patient satisfaction increased very sharply. you see that compared to some other countries which spend the same money as Turkey, the patient satisfaction is, higher than those countries, much higher than those countries. And I should say that it is very important to focus on financial protection if we talk about universal health coverage, if we talk about equity. So it is very important to reduce catastrophic health expenditures and impoverishing health expenditures. Within our health transformation program, catastrophic and impoverishing health expenditures declined 1/6 compared to the starting point. And it is very rare in Turkey. In my opinion, all of the countries should track what is going on about financial protection. A few countries regularly, annually track, monitor their catastrophic and impoverishing health expenditures ratio, but it's very important to monitor these figures if you really want to reach universal health coverage. What kind of policies we developed in Turkey about our health transformation program? Of course, you need to make a strategic and action plan, and you need some time to continue to perform your strategies and action planning. But you need to have the support of the public. So it's very important to have some low-hanging fruits, some fast results at the very early beginning, and to get the public support and to get the Prime Minister's support. Then when you go to the door of the finance minister, you can get more money. You can get more support from the finance side, more support from all other stakeholders. Unfortunately, there was very bad behavior in our hospitals before our health transformation program. They used to keep the patients as hostages until the family paid the bill. So my first day in my office, I announced my first decree, saying that no hostages in the hospitals. If anybody show that kind of behavior, it will be punished. Those hospitals, those managers will be punished very harshly. So this kind of approach gave me a great support from the public, and the public felt that my intention, my Prime Minister intention, my government intention is very deep to help our people. So it is very important to have a two-pronged approach, to make something tangible, to make something for the population needs, and prepare a strategic and action plan on the finance side and on the delivery side. And to me, it is very important to have a policy coherence in terms of finance, in terms of provision, in terms of dealing with other social determinants. So, as a Minister of Health, as a public health specialist, you have to deal with government budget side, preferably on the public insurance side as a single-payer insurance, and a single benefit package on the finance side. And on the delivery side, you have to deal with emergency transport, preferably publicly and totally free of charge, and primary care and hospital care, with a strong regulation by Ministry of Health, but of course with delegation, especially in your setting, in your context. Of course, the delivery will be made by states. So of course, you always keep your focus on equity, quality, and sustainability at the same time. I think that without having this kind of approach, just dealing with one part of the system, you have to very deep focus on that part. It is not possible to have a real success. It's not possible to make a real transformation and make a remarkable changes because all of the needs of healthcare are closely linked to each other. Let me give an example. Let's say that you want to reach very far rural distance areas for the emergency cases. You need the necessary roads as a social determinant. You need a strong, well-designed emergency transport system. You need vehicles. You need human resources trained. And of course, you need a free of charge system just to pick up, let's say, a bleeding pregnant woman and to take her to any center. So all of the systems are closely linked to each other. Our system was very fragmented and inequitable before our health transformation program. We made many changes, and at the end of the day, we had that kind of structure for a health system in Turkey. We established one single authority, social security institution, dealing with the finance side. The necessary money comes from premiums and co-payments from citizens, and by state contribution, by government, and deficit financing into the same social security institution. And government pays for the premiums of the poor as well. So social security collect all the money as a risk-pooling mechanism and spend that money for the needs of the people. On the other side, for emergency transport and primary health care, government spend all the money. I mean, those services are not related to the health insurance side. They are totally free of charge, all the citizens, and given by Ministry of Health. And I strongly recommend all the country to give those services free of charge. Because if you have a strong primary health care, it means that it will improve the health status of the population by prevention, by promotion, and it will decrease health expenditures as well. So it's worth to spend money for primary health care, whatever money you have, first. It is very important, in my opinion, to have a system that give all the services, primary health care services, free of charge to all the citizens. And Social Security institution, as a purchaser mechanism, split it from provider side, purchase the services in Turkey from service providers. Mostly secondary and tertiary hospital services are bought by Ministry of Hospitals and university hospitals. And some of the services are given by private hospitals, and pharmacies in Turkey are all work in free market, and it is paid by social security institution. Of course, citizens pay some co-payments, but almost all the services are affordable services. Even as a citizen, you go to a private hospital, contracted private hospital by a social security institution. If you have an emergency situation, if you need intensive care, if you need a major operation such as a heart operation or organ transplant, or if you need a very major disease treatment such as cancer, you don't pay any, even to the private hospitals. That's why the catastrophic expenditures are very rare in Turkey now. The system works something like that, simply. Citizens pay some extra to private hospitals when they prefer to go over there, but as I said before, they are protected from the harmful effects of the catastrophic expenditures, even they go to private hospitals. And as I said before again, on the implementation side, emergency transport, primary health care, and hospital care should be improved together. Now in Turkey, all the emergency transport are free of charge, including air ambulances, and we have many vehicles challenging with the very difficult winter season in many regions of our countries. And we established a family medicine from 2005 to 2010. It covers all individuals free of charge. Citizens have their right to choose their physicians. All the physicians have contract-based per capita payment, and the other has staff. And we give extra payment for working in disadvantaged areas to health staff. And there are some different coefficients for different service needs to allocate the money and resources. We implemented some incentives and disincentives for efficiency. For instance, if you don't, as a physician, if you don't reach a certain level of vaccination for your children, the system cuts some of your salary. But if you, for example, do some successful studies for the patients, your recorded patients who have hypertension, you will take some extra money as incentive. So it increased the performances in quantity and quality on the family medicine side. And we had very fragmented public hospital system in Turkey. We brought public hospitals together under the administration of Ministry of Health as semi-autonomous groups, and we initiated performance-based management for the managers and performance-based payment for the doctors and other health staff. It increased productivity very much. When you speak on finance of health expenditures, it is very important to increase productivity and to increase efficiency and to have some efficiency gains at the same time. We established a central patient appointment system for all the people, and we established home care services. We give some home care services to some patients because it is much cheaper and much comfortable for the patients. And we never set laissez-faire. It is very important on the financing your system, because very rare countries have their resources, especially human resources, enough for their needs. So we have limited human resources in our countries. So it is very important to have some regulation about resource allocation and recruitment rules. You should consider your country resources as a whole, and you should keep public and private healthcare balance very carefully. Because when you start to have some services from your private sector, it means that private sector easily can suck almost all the human resources, especially the specialists, and it will not be possible to give the necessary services in your public hospitals. It means that time by time, the public sector will increase the prices, and you will have to spend more money. So it is very important to have a strong public services if you really want to take some services, buy some services from private sector. That's what we achieved in Turkey. Almost 84% of the services are given by public care facilities in Turkey now, and 16% of the services are given by private care facilities. I know that the private sector is very strong in India, in some other countries, but it is necessary to strengthen the public side to decrease the prices on market and to have an appropriate benchmark to control the expenditure increases. And for that reason, you have to have some regulatory effectiveness on your Ministry of Health side. So in Turkey now, low and middle income people get the hospital services generally from public care facilities. Middle income people get the services from public hospitals and private hospitals. And upper middle income and high income people generally prefer to get the services from private hospitals. So mostly the services are given by Ministry of Health. Emergency transport free of charge, primary health care free of charge, and most of the hospital care are given by Ministry of Health. Some hospital care given by university hospitals, and some are given by private hospitals. And all the pharmacy services are given by a private sector. So of course we increased our public expenditures for health care. And I should confess that the most difficult side of my job was that. So it is, I mean, in order to increase your public budget, government budget for health, sometimes you have to be very patient. You have to go to your finance minister and knock her or his door just to persuade her or him very patiently. Let me tell you a short anecdote. You know, the budget time, all the ministers go to the Ministry of Finance and try to get some more money from finance minister. It was very late night time, and I was trying to persuade my finance minister to get some extra money for some needs. So he was keeping on saying me that, Recep, it got very late. Please let us go to our homes. Go our homes. And I told him that, okay, my dear friend, you can go. I will stay here. I will sleep here. And tomorrow morning, we will continue to discuss on the budget. He began to laugh as you, and he called his deputy minister. He gave me some extra money, not too much, but at least achieve to get some extra for some needs. Our health budget increased almost 3 times within 10 years. But it was not too much because our economic growth was in parallel to our health expenditure. So you have to monitor, as a Minister of Health, you have to monitor the economic growth, and you have to try to persuade the government, your Prime Minister, your Finance Minister, to get the same rate of money for your expenditures. I know that economic growth is excellent in India, so it is highly possible to get more money in future for health expenditures. Without the necessary economic growth, it wouldn't be possible to get more money. But in your setting, it might be possible. When we talk about finance, it is not only a matter of increasing your budget. If you really close the gap of your budget, you have to have increased efficiency as well. You have to have some cost containment, but not cutting the services, cutting purchasing prices, using your purchasing power. If you have a strong public health system, you will have very strong purchasing prices, and you can easily get much less cost for the drugs, for the other equipment, and for other services. So we established a new drug reference system, and we decreased the drug prices very much and in very short time in Turkey. We started to have some services from private sector. For example, we had only 18 MRI equipment in our public hospitals before our health transformation program, and after 10 years, now we have more than 300 MRI equipment in our public hospitals because we implemented service procurement very common in our public hospitals. We make some tenders. The companies compete with each other. They take equipment, they take technicians, even they take radiologists, and we buy directly services, not the equipment, not the other things. And we started to give performance-based payment to our health staff. It increased productivity very much, and we stopped gradually working publicly and privately together for the doctors. It is very important to end the dual practice up on the doctor's physician side, because I don't think that you can have the necessary productivity if you allow your specialists, your doctors, to work publicly and privately together. And of course, you have to try to decrease your health needs, promoting healthy lifestyles with adequate prevention and increased health literacy. Thank you very much.